Aloha and welcome to the Beyond Breakthrough Show, where our vision and mission is to help others break through barriers and unlock their full potential for an abundant life of health, wealth, and freedom. My name is Jeanne Grosso, and I'm coming to you live from Honolulu, Hawaii.
Hi, and I'm Sharla Land, and I come to you from the Phoenix, Arizona area. Welcome to today's show, guys. I just wanted to say hello to you, Jeannie. I know it's been a little bit since we've gotten together, and I just wanted to just share with the community, with our people here, just who you are, your background, how we met, just real briefly. I met Jeannie about 12 years ago in church, and one of the things that we just immediately kind of gravitated to each other because we are number one, sisters in Christ. But then as we got to know each other and know each other's hearts and our stories, what I really loved about Jeannie is her passion and her commitment to sharing truth with others about health, life, finances, business. And Jeannie, you come from a wealth of experience. You have been a former wellness owner. You are a medical massage therapist, esthetician. You are a nutrition expert, and you come together with all these great attributes. And what I love about you is your mission and vision to help people not only to make decisions and choices about their life and being healthier. What your mission is too is to help people prevent the things that you've seen in your life, in particular with your family, with your mother and your father, and how that really sparked your interest in seeking truth and finding out how to get to the root cause of the disease or diseases and figure out how we can eradicate and prevent it from even happening. So I love that you come with all this wealth of experience and knowledge and education to contribute to the community in which we're developing, and it's growing in such large numbers now at this point. But we want to welcome Jeannie here today, and we're going to be talking a little bit about our neurologic function and what happens and what is affecting us. Jeannie, what do you think has really been contributing? You know, we hear a lot of people in our communities and our circles talking about, brain fog, memory issues, sleep deprivation, inability to focus, and feeling scattered. What do you feel maybe contributing to these issues and people are facing today?
Yes, thank you, Charlotte. Thank you for the introduction. And I just want to say that what Charlotte said is our topic today is brain breakthrough. And it's a very near and dear topic for me because when I was 21 years old, we lost my father due to heart disease at age 62. And at that same very time, they had been testing my mom for dementia. At 58 years old, she was afflicted with dementia and later died with Alzheimer's disease at age 72. Now, this was 34 years ago. So this is what drove me to go from the finance and banking industry into health and wellness. And although I did start out with medical massage and skincare, I quickly, within a couple of years, was introduced to the root causes of all these diseases by a doctor in Fort Lauderdale who was talking about toxicity in the oxidative stress and nutritional deficiencies. And these three factors are the top factors that are affecting everybody's health in the world. Okay, so from the time we're born with a number of toxins in our umbilical cord, hundreds of them. And then there's toxins in the air we breathe, the food we eat, the water we drink and bathe with, and through our skin. So this tied into my mission to find ways to prevent and reverse disease. And then now I want to introduce back to why Sharla and I are so excited about launching this new show on this topic as well. And my friend Sharla, one of the things about her is she has been a nurse for 30 years in palliative care and hospice. When I met her, she was in hospice. Then she moved to palliative care, and currently she's working in the neurological unit. So 30 years, her 29 years for me, we have collectively 60 years experience that we're going to be sharing with you on this episode. And so really pay attention and tune in, because what we're about to explain to you is the biggest breakthrough in human health history and in neurological health, which is also brain health and mental health. Now, every single person needs to know about this. So I'm more curious about, Sharla, what you're learning now in the medical community, because as we have come to learn by just looking at the medical community as a whole, the commonality of every disease that we're faced with, there's 78 classes of disease, which covers everything. And what we had found is it's a vicious cycle, that when your body's levels of glutathione are low, it leads to disease, and disease leads to low glutathione levels. So it's this vicious cycle of low glutathione levels. And then in the medical community says, well, let's give them a pill to it. Well, we already know from the Alzheimer's Association and all the publications that are out in PubMed.gov, there's over 186,000 studies on the glutathione molecule alone. But in the medical community, they've already said there's no known cure for cognitive decline, for Alzheimer's, for Parkinson's. They even admit they don't even have a drug for that can do anything. And then other studies have completely shown that nutritional support radically, on 100% of the patients that were tested, radically reduced cognitive decline. So we've met people like Dave Larson from the American Brain Council. He has his own site that he has put up, abcbrain.org, and anybody can go to that site and learn ways to prevent and cognitive decline and even reverse it that are proven. And the whole medical community doesn't even have a drug for that. So Sharla, can you talk about what you're seeing in the neurological unit, your patients in hospice care and in palliative care, end of life care? I mean, one of the things that struck me about Sharla the very first time I met her was her compassion. I mean, she definitely has the gift of service and compassion like I've never seen anybody in my life. I even asked her, of all the nursing modalities that you could choose, why did you go into beauty and do beautiful face things and skincare nursing or cosmetic surgery, even nursing? I mean, why hospice and palliative care? Why the end of life? And I'll never forget what she said. She wanted to be an integral part to be able to witness to people before they die. And then since then, I mean, 30 years is a long time to completely watch the failed medical system kill these people. And I want you to share with others what you shared with me, what that's done to you personally as a professional in the medical community, and where you're going with that now.
Yes, thank you so much, Jeannie. That was beautiful. I think like-minded people and like-hearted people really tend to gravitate together. So we're a mirror reflection of each other, and while our approach may be different, but our hearts are aligned. And thank you for that. And that's a lot to tackle, some questions that you answered, but really, I'll start off with what I'm kind of noticing today and what's relevant in what we're seeing today. For some reason, it was very tempting, yes, and I don't think I haven't thought about going into the beauty aspect of nursing and injections and this and that and the other. But when you get down to it and you really start researching what are in those injections and what is in Botox, is just toxic to the body.
Yeah.
So what really drove me is, trying to find natural ways to reverse aging and have that youthful look. And number one, I know that you and I know the secret to anti-aging truly is the joy of the Lord. When we have the joy of the Lord, we can't help but anti-age. We can't help
That's
but
right.
appear more young and youthful because we have so much to be joyful and blessed about. So I segue that into, thank God we have our health, and thank God that we are seeking out truth to help people prevent and avoid these symptoms and things that are happening. But what I'm noticing now in the hospitals and transitioning, I had my reasons for transitioning from hospice into acute care setting. And for whatever reason, those goals and things. But what I'm noticing is a huge increase in strokes. I see a lot of patients. I work on a neurologic unit, a progressive care unit, which is where they come when they're coming out of ICU for strokes, cardiac catheterizations. We have people who are withdrawing from narcotics and medications, alcohol withdrawal. So we see anything that has anything to do with neurologic function. So what I'm noticing and seeing is that there are greater numbers of stroke that are happening than I've ever seen in my 30 years of nursing. Stroke is one of those things that most people fear a lot and fear most. And then when you combine that on, unfortunately, I see people who have already a diagnosis of dementia, and then they have a stroke on top of that. And that can be absolutely overwhelming for patients and families. But it's also overwhelming and burdening our healthcare system. But I started to wonder, like, what is it really that may be contributing? Because I think about those root causes. What could be causing such great increases of stroke? What can be causing people at young ages? I mean, we're seeing people coming in. We had a young, I call him a kid. He's an adult, but 22 years old, who actually died from multiple infarcts in the brain. And there's couple different types of strokes. One's a ischemic stroke, where maybe a clot or plaquing in the arteries have blocked a vessel in the brain and stopped the blood flow to that area of the brain. And then we also see hemorrhagic strokes where you can get an opening in a vessel in the brain and it can bleed into the brain space. So we see traumatic injuries happening in the brain, and I'm wondering, what can be contributing to this. And we've talked about this before with 5G, and when 5G rays or EMF waves hit our bodies can't help but absorb that. It's an invisible thing that we can't see, but our body's energy, it's electrical energy. We have electrical conduction in our heart. And then we also have energies that flow in and through our bodies. We all know this. We know that, putting our feet on the ground outside and grounding is very important to being able to help detoxify our bodies. And so I feel like, number one, we have a very high toxic burden. And a lot of people took the jab. And I really feel that put a lot of toxic burden on our bodies and in our cells, and cause a whole other set of issues. But what we're seeing is that people are hypercoagulating, meaning they're clotting, their blood is clotting much easier than it used to, even a decade ago. So I think part of it is due to 5G. It makes a very serious neurologic, what's the word I'm looking for, Jeannie? It's a neurotoxin. And when 5G waves or EMF waves, microwaves hit our body, it mixes with our body's nitrates, and it makes it makes a neurotoxin called peroxynitrite. And peroxynitrite affects everything from memory, brain fog, ability to sleep, ability to focus, ability just to remember things day to day. I hear that a lot. And I also can't help but wonder if that isn't also contributing to stroke and also contributing to worsening dementias with people, because we can't escape it. And one thing I'm very grateful about is, and we're going to kind of segue into what we've discovered just as little as a little over 2 years ago. And even as a nurse, I wasn't aware of what the molecule or amino acids that combine to make a molecule called glutathione. And what glutathione does is that, number one, is our body's main detoxifier. And I'm finding with disease and with outside toxins that if we eat, breathe, and drink, we're taking in toxins constantly. And as Jeanne said earlier, our bodies, there's 200 known toxins and chemicals in our environment that we take in through breathing the air, eating the food, drinking the water, and then a chemical exposure to things that we clean with, our shampoos, our soaps. So we have to be very mindful what we're putting in our bodies and making sure that we're number one, trying to eliminate those things. But we also need to look outside of besides elimination, what can we do to give our bodies to help combat these diseases? And these 78 classes of diseases and conditions that all diagnoses, there's thousands of diagnoses, but they all fall under the 78 disease class umbrellas. So even with dementia and Alzheimer's, those are under an umbrella called organic brain syndrome. But what we have found and what we have seen showing huge significant changes with our own health and our own life and our own ability to stay focused and think clearly while preventing things like stroke and dementia is the glutathione supplement. And what we're found is that it was, very difficult to get in the body up until now. We know that with some people that we've become aligned with, that they've been working on a solution to this for about almost 20 years now, since 2006. And with this discovery and technology that we came across to help combat this, glutathione is not only our body's main detoxifier, but it's also our body's sole immune system protector. So when I see these people in the hospitals with severe stroke, with dementias, they also have secondary, or what we call comorbidities. They have infection on top of the condition they came in with. Maybe that stroke could have started from a urinary tract infection. What I'm finding when people have infection, their blood thickens and they become more prone to blood clotting. And then that clot can travel to the brain, which is stroke. They can travel to the heart, which is heart attack, or can travel to the lung, which is a pulmonary embolism and can stop your breathing in your heart. So when we see these conditions come in and we see that they're already had an underlying infection, and oh my gosh, it could have led to this stroke. Or we see people, diabetes is huge and prevalent in our society right now. I think the latest studies show that 30 to 40% of the communities have diabetes, which diabetes is a precursor to stroke. So what is it that we can do to help sequester and help stop these diseases and conditions from getting out of hand? Number one, we're all depleted of glutathione. This is what I recently learned. And as a nurse, we don't get this kind of education in school. We don't get this because, number one, our schools are paid for and funded by pharmaceutical companies. Same things with medical schools, teaching our doctors and educating our doctors. And it's really sad because nurses and doctors have the same amount of nutritional education. But really what it stems and comes down to, as Jeanne was mentioning, is what we call a syndrome. It's from toxicity, deficiencies, obesity, and stress that bring about these things such as stroke, such as dementia, such as heart disease, such as lung disease. Everyone is affected differently depending on how your cells react to the inflammation that's occurring and happening in the cells. So that's what I'm kind of seeing on a general level in the hospital. I work in a hospital that's in a high retirement area, but I'm telling you, we're seeing people in their 20s, 30s, 40s, and 50s also that are having stroke. The other thing that I think, and I started to mention earlier, is about the jab and how that has increased the toxic burden on our bodies. Because if you don't have enough glutathione to get rid of it and get your body back to a level of homeostasis where it's combating this toxic burden, we don't have a chance. We're going to continue to get sicker and sicker. And doctors are going to keep prescribing pills and pills and pills. And now I got to take this pill because I got that pill. Our livers are overburdened. Our kidneys are overburdened. I mean, look, I watched COVID, not COVID itself, but I watched the protocols of COVID kill people and kill the kidney function. And then once your kidneys can't filter anymore, the toxic burden gets too great, and then you end up passing away. So that's part of the problem I'm seeing, Jeannie, is that we're suffering such high toxic burden and people don't know how to get rid of it. And one of the things that we've discovered is the glutathione being able to get, and I'll have you talk a little bit about the technology behind that and how you found this and how this we are finding is saving people's lives. Literally, this is changing, transforming, and saving people's lives. And I'm really glad to be part of a community of aligned people who are alive and awake. And that's what we're here to do, is expose and talk about what we're seeing and how we can combat it and fix the problem.
Well, I just have a couple questions just off the top of my head. What, after a patient comes in with the strokes and they're now in recovery, what are they doing for them? What are they giving them?
Yeah. So based on the type of stroke, the time that it takes for them to get and seek medical attention, the clock is ticking. So when they first come into the emergency room department, the stroke protocols are initiated right away. And there's certain interventions that have to be done in order to reduce the impact of that stroke in the brain. And the faster we react, the faster we get initiating the treatment. And there's always a room and a place, right, for medical interventions and care. But the issue is what are we doing after they've been stabilized and up on the floor? So when they come up to the floor, number one, we have to do a neurologic assessment on them 3 times in a 12-hour period. So every 4 hours, we have to check for changes in that neurologic status. Are they improving? Are they getting worse? Do we need to initiate certain protocols? So certain strokes require certain protocols. Ischemic strokes, either caused by clots or plaquing that breaks off and gets into the bloodstream, they most definitely, almost 100% of the time, are put on blood thinners. Because of that ischemic stroke or that issue that the blood clotted and the clot went to the brain, we're going to immediately put you on a blood thinner to keep that blood thin.
One thought right there, if I can interrupt. So you're adding more medication to the situation. Can you explain the blood? So you're doing a blood test, so you know. So what's going on with the hemoglobin? Because I have a lot of people that say, oh, I just got my blood test back and my hemoglobin is low or something like that. So can you speak to that? And what does a medication do for that, next to what glutathione does for the blood and the hemoglobin?
Yes, absolutely. So hemoglobin plays a critical role in, well, the red blood cell's role is to carry and attach, so the red blood cell is part of a red blood cell's hemoglobin, okay? So we look at hemoglobin levels, and when somebody has low hemoglobin levels, we're looking at are they bleeding somewhere? Do they have a small leak in the gut? Is it esophageal? Where is this bleeding occurring that's causing these hemoglobin? So basically, it means there's a low level of blood in the system. So when people get to a level of 7, normal hemoglobins are ranging from 14 to 17. But when somebody gets to a hemoglobin level of 7, we're going to have to transfuse them. We're going to have to give them red blood cells to replenish what they've lost. So sometimes people can be losing blood and they're having issues with the blood thinning, trying to find the right balance, because as their blood is as they're losing blood somewhere, sometimes people don't even know, because the body's reabsorbing that old blood back into the circulatory system. So it's like a slow thing that can happen. So we have to, the normal medical protocol is to give them a 1 unit of packed red blood cells that's well oxygenated and from a healthy person in order to help. But that's really only
But we don't
a
even know who's
Band-Aid.
healthy now, because the blood bank could be infused with people that took the jab.
Yes,
So
yeah.
at that point, if you need a blood transfusion, that's probably pretty serious, right?
Oh, absolutely. And we see people who, even after we give them a blood transfusion, their body doesn't respond. So doctors are doing and working diligently to try to get to the bottom of where's the bleeding occurring? Do we need to scope them? Do we need to they do a barrage of tests, not just lab work. Then they go in and do a colonoscopy, or they do an endoscopy, or they go in through the esophagus and
It
go in
sounds
and look around.
ridiculous.
Yeah.
So, but they're not solving the issue in the blood and the low hemoglobin. So what does glutathione do for that? And why aren't they giving them glutathione
Yeah.
in
So
any form?
So number one, it's a lack of knowledge. And again, there are protocols set in place by the American Medical Association that determine what certain protocols are for certain types of conditions. And glutathione, unfortunately, is not one of those, because it could significantly hurt the pharmaceutical industry, right? And it would cause
And
them
it's
to
killing
take a
people
look
by
at
not giving it to them.
Yes, absolutely. So glutathione has to do with over 400 functions in our body, 15 of those which are critical. So what glutathione does is it supports strongly the systems that are in place in our body to help correct those things by stopping and healing the area of the body or the gut that may be leaking that blood. Because number one, glutathione has everything to do with gut health and restoring homeostasis and the right balance of pH balance, acid-base balance in the gut, but also the right amount of good bacteria that's in our gut. So it really helps support those things so that we don't have micro holes in the gut that are leaking blood or fluid into the abdominal space. So those are some things that we could be instituting at a medical level, but what those doctors are doing, yes, we have to use emergent things and the medical system or whatever we need to get that to stop. But if they were to incorporate glutathione as part of even if they did it IV glutathione, because we do use IV glutathione in the emergency room for Tylenol overdose. I don't know if you knew that.
No.
And the reason that they use glutathione for Tylenol overdose is because they know that glutathione is produced in the liver 1,000 more times. The liver cells use glutathione 4 times more than the regular cells in the body, or up to 1,000 times more. So they have to use the glutathione so that the liver can detoxify itself. Because acetaminophen, which is generic for Tylenol, it can be very toxic. Because people just are popping it like candy because they're in pain, right? They're hurting. They have inflammation somewhere. And again,
some women are using it just for cramps and things like that. When I've never touched Tylenol because I knew about it, but there's so many people out there that take Tylenol for a headache or a hangover, and they don't even realize if you're taking it for a hangover or a headache that you're toxifying your liver even more, and you can go into failure.
Yes, absolutely. So with that, I say all to say that we do actually use glutathione in a medical setting in a hospital for those types of things. But I think if the doctors were to realize that, and we're going to go back to talking about glutathione and how that attributes to hemoglobin. And so hemoglobin also is the ability for the body to carry oxygen on the red blood cell to oxygenate our body. That's when we take a deep breath in, the air exchange in our lungs. We oxygenate that red blood cells, and then it goes out to the body to give us oxygen right through the blood. But when we have low glutathione levels, let me back up. The red blood cell and the oxygen, they are supposed to bind together. The only thing that can help them bind together is the glutathione. So you need the red blood cell, glutathione, and then oxygen. If you don't have enough glutathione, your oxygen is not going to bind to the red blood cell, and you're going to lose oxygenation. You're going to have less circulation, or more poor circulation. you're going to have where the blood isn't being cleaned and exchanged, and you're going to have higher levels of carbon dioxide. So those things can lead to brain fog. Think about it. If you're not perfusing to your brain enough oxygen, you're going to have brain fog, lack of sleep, inability to pay attention, attention deficit. We have ADD is so prevalent in these days and times. If we're not taking something to help oxygenate our brain better, and that's just only one thing that glutathione helps with our health in our body. I see
it
people
sounds like the most important thing too, because if you don't
absolutely.
have oxygen transfer from the blood, which is part of the blood is the hemoglobin, right?
Yes.
I mean,
yeah.
So you
Part
go
of the
in,
red blood cell.
okay, so you go into a lab and you get blood work done. And what is that how they can tell if you had a stroke, if you had low hemoglobin, or what does that mean? Like on a blood test?
So hemoglobin isn't really the indicator that could be directly linked to, say, a stroke. Yes, can that happen where somebody has low hemoglobin and it contributed to a stroke? Absolutely. There's usually other factors too that go along with that. Poor diet, no exercise, dehydrated. And those are all things that, you know, our bodies kind of go down this vicious cycle, and we're trying to, and that's kind of part of too.
Well, I would think, does medication do that as well? Because the toxic burden from medication and the oxidative stress.
Oh, absolutely. Medications definitely contribute to the toxic burden. Because you're not
radiation, those kind of things too.
Oh yeah, absolutely. And I've known people who've had chemo and radiation who developed and had a stroke because of the chemo and the radiation. That's a known side effect.
Okay, that makes sense, because that would lower your oxygen level every time you get injected with a whatever that you get injected with, because where does it go? It goes into the blood. And you're saying that glutathione is the sole binding agent of oxygen to the blood, to the blood cells, to the hemoglobin. And
otherwise, they're polar opposites. They bounce off each other like a
okay, and then that could not only cause a stroke, but it also can stop your heart and other liver functions and everything else. So because
you think about it, if you're not exchanging oxygen and oxygenating well, and it's going to lead to a plethora of breakdown in your body and inflammation. Because you're talking about your kidneys aren't going to perfuse well, they're not going to get good oxygenation and get good circulation. Your liver's going to suffer because it's not getting the right oxygenation. And then you're not reducing the toxic burden. So your body's having to try to filter these things out when it's already low in glutathione. So then you're adding more. It's just this vicious cycle. So what we've talked about, you know, just even yesterday, is breaking that cycle, that vicious cycle, by giving yourself a dose of glutathione to be, I mean, we're seeing people stop symptoms in their tracks, right? With glutathione, we're seeing that with our HERS product as well. So I know for me, when I'm taking a dose of glutathione, I purposely take 10 nice cleansing deep breaths, because knowing that's getting into my cells within 70 to 90 seconds, I'm going to take advantage of taking in as much oxygen as I can and having as much oxygen transfer as possible, so that I can, number one, wake up my brain, wake up my memory, wake up my attention span. I'm going to be, I can't even tell you. And then when we added the new one, the Neuro, unbelievable how these two synergistically together are really making a huge impact on our community that we belong to. That is just making a huge difference in health. I mean, from let's talk a little bit about neurologic conditions, progressive neurologic, and I can't mention any names, but you guys can imagine with any progressive neurologic disease that we see out there, the glutathione is the sole protector of the myelin sheath. Helps protect the myelin sheath that protects our nerve endings. So when you think about progressive neurologic and we see the breakdown of the sheath, we see that in dementia also, or we're not supposed to mention names, with cognitive decline and the disease diagnosis that goes along with that. We see that glutathione is making a huge difference in protecting the nerve endings and protecting our cells and the DNA from unraveling. And that's huge and important, because when our DNA re-replicates and copies exactly, it can copy disease cells and disease, or it can copy complete healthy cells. So what the glutathione does is helps the cell to stay healthy and the mitochondrial DNA to stay healthy and re-replicate exactly how it was in a healthy state. So that's how we gently start peeling back the layers of disease and inflammation, by continuing to take the glutathione that is the basis for all things health, cellular health. It's the helps the mitochondria is the powerhouse of our cell. It's like the battery, and one cell's energy is tremendous. I mean, God created a miracle. So yeah, I mean, we see a lot of body and system breakdown because of low. I mean, go to pubmed.gov. That is the U.S. Library of Medicine. And there's over 100, there's like 100, almost 187,000 studies now on glutathione. So all you have to do is go to pubmed.gov and go right in straight to that search bar, type in glutathione in whatever condition, and you're going to have thousands of studies that come up in regard to what they're finding. The glutathione is huge and transforming people with severe diagnosis and disease. There's a lot of suffering.
Yeah. Wow. Thank you, Sharla, for all that insight. And let's just close with this, is we have a major problem in the world, and that is neurological health. We've got heart disease, we have strokes, we have cancers, we have diabetes. All these diseases are not being helped through the medical community. They're just causing this endless need of more medicine and more side effects and more medicine. And that we've also learned the problem, and now we have the solution. For the first time in medical history, there has been a new development where they took that miracle molecule, glutathione, single-handedly, has over 400 functions, and the top 3 functions are the solution to the top 3 root causes of all these diseases in these classes, all bacteria and viral infections. And they are toxicity, and toxicity leads to oxidative stress, and oxidative stress is what kills you instantly, causes the disease, or shortens your life in premature death. Okay, so it's single-handedly oxidative stress is the issue that causes the inflammation, also known as whatever disease class it falls in. And then glutathione molecule not only is the master antioxidant that combats the free radical toxins and the oxidative stress, but its third function, main function, is it's the primary detoxifier and chelator of heavy metals within the cell, within the cell membrane. So in the first time in history, just 3 years ago, the development was an ability to take that glutathione molecule, reduce the particle size under 10 nanometers, so it can easily penetrate a cell membrane in seconds intact, just by taking it submucosally under the tongue, swishing it in your mouth for 30 seconds, a couple minutes, and then swallowing it. I mean, it doesn't get any easier than that. And all hospitals, all care homes, all human beings need to have this critical molecule. And that's what makes this the biggest breakthrough in human health history, not to mention something that's complementary to every healthy lifestyle, every other practice and in competition with nothing else in the world today. And that's what we're really excited about. So, and with that, we have another new development that just launched a month ago in August 1st, specifically for neurological and brain health and mental health conditions. It also includes glutathione, L-cysteine, and curcumin, like the one product does. And now we have 14 additional nutrients and for the brain that can get in with this breakthrough technology directly into the blood, cross the blood-brain barrier, and into the cells in seconds. It's never been achieved in history before. So now we have 2 products to improve dramatically brain health instantaneously. And that's what we're super excited about. And our next episode, we will be discussing women's health and hormonal balance. So stay tuned for the next one, and ask us for the link to get yourself some of this powerful nano glutathione and neuro brain function swish product. Thank you for joining us, and we'll see you next time. God bless you.
God bless you guys. Thank you.